Mr. Davis from Kentucky is recognized.
Thank you, Mr. Chairman. Mr. Ryan's amendment would strike the government-run plan from the underlying bill. A government-run plan is simply unworkable. It doesn't get to the root problem of affordability nor cost. The bill in front of us today is called America's Affordable Health Choices Act. I don't know who came up with the name or how they define affordable, but well over $1 trillion is not considered affordable in Flatwoods, Kentucky, Hebron, Kentucky, or Cynthiana, Kentucky. Tens of millions of people, if they're moved to a government plan, as studies predict, you might as well have a card that says you're covered, but in my district, if you can't find a provider who'll see you, it's worthless. That's not coverage, and the reason is this bill does nothing to address the core system reform issues that some of us have been talking about literally for years. Indeed, by not fixing the process at the core, which this does not, we're going to increase cost of the process and overhead, we're going to limit reimbursements and reduce them, and ultimately you can't end up with anything but a ration care system. In order to have true reform, you have to do three of the following things. Number one, reform and re-engineer Medicare and the Center for Medicare Services, which is not in this bill. Second, true reform of the private insurance system to allow improved competitiveness, reduce costs, and increase access for small business and individuals. And finally, the thing that is outrageous that has not been addressed here is meaningful medical liability reform, which is necessary to free our providers so that they can function and do their job. I would ask you this, as one doctor in my district said, Jeff, who's going to sue me now? Is the government going to get sued, or is it going to be the doctors still liable when we're mandated in how we can diagnose and how we can treat? Without all three of the things that I mentioned, we fail in our shared goal. This is no game. This is not about politics and partisanship. It's serious. It's about human lives. We're talking about spending well over $1 trillion just to get the bill and the public plan started, and we don't know even specifically what we're going to get in return or what the long-term costs will be, as evidenced by the head of the Congressional Budget Office earlier. We don't have the details, we don't have the facts in front of us today because the process is being hurried along by artificially imposed timetables by people who have never worked in the professional healthcare world in their lives. This legislation will have generational impacts, so we've got to slow it down and take the time to consider the bill and ask the real experts, the ones that give the health care to our citizens, not think tank professionals who are subsidized by wealthy people and don't take the 3 o'clock in the morning call to go to the ER. We need to slow it down and get these practitioners from the field in here. I want to close with a quote from an email I received from the CEO of an extraordinarily well-run rural hospital in my district. We absolutely cannot reform health care in this country if we don't get a better grasp of what drives the health care cost. I am so frustrated because too many of the decision makers have little real knowledge of what needs to be addressed. It's not as simple as cutting payments to hospitals and doctors. Who's going to peel away the layers that find so much of the costs I have in operating the hospital come from? Things like the rules, regulation, unfunded mandates, hidden energy costs, malpractice costs that do create defensive medicine, and on I could go. I greatly fear for the Medicare patient as more and more doctors speak of closing their practice to the aging and complicated patient. Other than war, in my lifetime, I don't believe there's been such an important task at hand, and it's imperative that the voices of many are heard. Close quote. A government-run health care plan will not live up to the promises made by its proponents. It will hurt health care providers, reduce quality, all at a gargantuan cost to our children. I encourage my colleagues to support the Ryan Amendment and embark on an approach that will yield true reform, improve access, improve quality, and reduce cost. Thank you, Mr. Chairman. I yield back.